Welcome to the Peaked podcast, where I talk about gender identity ideology and other bad ideas, women's rights, and free speech from a European point of view. So, Ruth Parry, how's it going? Thank you very much for joining me today. How are you?
I'm good, thank you. Yeah, I'm fine.
You know, I never talk to British TERFs really on my podcast. And the main reason is because, so I'm based in Europe, as you know, with this place called Europe, which I sort of feel like Britain isn't part of anymore. It's a weird psychological thing. And every time I see the UK mentioned in the context of Europe, I have to do a double take. But the reason why is because people over here in Europe tend to think or pretend to think that this is an imported UK thing and it's not happening here. And so the more we see
You mean turfism?
turfism, yeah, or like the bad second order effects of erasing sex in law, like it's all like, oh yeah, I heard that that's an American thing or whatever.
Okay, yeah.
And that's not true. It only seems to be an American and a British thing because, well, there's loads of reasons why British turfing is the best kind of turfing, but like many reasons. One of them is the high quality of the turfs. The other is the high quality of the certain media outlets who are just not afraid to go there. We don't have that in the rest of mainland Europe. So the editors conveniently pretend none of this is happening.
Yeah.
And then when I say, oh, well, yes, it is. And then I try to point to my podcast and then they say, oh, yeah, there's Brits. Yeah, that happens over there. So that's the reason why I don't talk to Brits. But this time, I think you may be the first British person I've ever spoken to. Not that I've done a whole lot of things, but the reason I reached out to you or you reached out to me was because I have a concern about a very European theme, which is the statistics, quote unquote, the survey data that we rely on the continent in the EU for very deranged policy decisions related to trans and gender and sex and law and stuff. And so I put out a tweet saying, like, I was thinking, surely there's someone who can help me look at this data and tell me if my hunch is correct. And so I put out an appeal and you were the most enthusiastic responder. So thank you. So you were like, oh, I'll do that. Is that for the cause? Or were you just like, did you looked at the data and you were like, oh my God, this is crap? Or was it a bit of A, a bit of B? Or
Well, I had a very quick look and it looked like there were some problems with it. But yeah, for the cause. So I'm early retired as a professor. I'm not a statistician, may I say, but I can, nevertheless, there's plenty to say from my knowledge base. And yeah, being early retired, one of the things that I want to do is use what abilities I've got to just improve the knowledge, bring knowledge and understanding to this really problematic.
that's the beauty of this. Like, I know Helen Joyce of Sex Matters has spoken about this before, that everyone has sort of taken their own particular talent and applied it to the problem. So your talent, you're going to explain to me what your talent is in a moment. But what comes to mind always is Helen Joyce saying, oh, there's one woman who paints turfy messages on rocks, this turf rocks,
Yeah.
which is really funny because she likes painting on rocks. So she applies that to her turfing. And so that's what she does. And then other people, all domains. So,
Well, tweet, for instance, or,
tribunal tweet.
rapid typists, that kind of thing. Yeah.
Yes, exactly. I love it. It's just such an amazing cottage industry of very committed people. So what I'm interested in is, can you explain really, because I am stupid in lots of ways, what is a statistician and what is it in your background that makes you able to look at this data and tell me a thing or two about how it was carried out?
Okay. So a statistician is somebody who specializes in, working with numerical data, and there's specialisms within it. For instance, you might be using statistics or wanting to use statistics to look at a current population. You might be wanting to use it to make predictions. So I don't know. Well, even the most basic thing, is this drug statistically better than that drug, that kind of thing.
Right. But was that your domain? Sorry, go ahead.
Well, no, I used to be, and I qualified as a physiotherapist and worked in the NHS for about 8 years. But I was always quite nerdy and swotty, let's put it like that. And I did fancy doing research. And I moved into a role that was advertised on a randomized controlled trial. So randomized controlled trials are particularly prominent in the health field, and what they're regarded as the kind of gold standard for scientific sort of studies of particular things. They can't answer all questions, but the randomized controlled trial I was on was simply looking at whether additional physiotherapy for somebody's arm after a stroke improved those people's outcomes. So that was very much a statistical analysis. That was how the analysis was done. But through that job, I took a master's in medical science, which really opened up my world and thinking, and it included social science sort of pursuits. So social sciences are not so much about does an intervention work or not. They're more interested in how do people do things together? How do people behave? Those kinds of things. And I also did a PhD, and part of them, certainly in the UK, there's an increasing push for scientists who are doing PhD to study science and scientific research more broadly, so we don't come out with a super specialism in a teeny weeny area, but have a bit of broad background. So I've designed and conducted surveys in my own area and done plenty of studying and critiquing of survey studies there. Particularly, I guess what's important in surveys is firstly who you ask and how you find those people to ask. Because generally you might want a survey to tell you something about the population in general. And we'll get onto that no doubt when we're talking about the particular EU survey. And the other thing when you're designing a survey is that you want to get the questions right so that they're picking up hopefully useful information, and so that 3 different people reading the same question don't interpret 3 different meanings. You want that tight and you want it manageable. So I've done quite a lot of studying and designing of survey type research.
Right.
And I said one last thing, which is then when you come to analysing, you should be doing an analysis, and the claims that you make from your analysis should fit or should be based on the data that you've collected. It's obvious, but again, there's issues in this survey around the kind of claims that are made at the end of it versus what data they've actually collected.
Right. And so how common is it to come across, like, I guess you're like a vulture when a new piece of legislation or policy comes out and it says this decisive statistic, like, the reason we're introducing this thing is because 29% of X population suffers from Y. How common is it to dig behind those statistics? And I'm thinking particularly in government stuff. But how common is it for people to just get it wrong and spout bad data and bad statistics? Like, the UK is pretty accountable, I have a feeling. Like, I feel like you wouldn't get away with it really easily in the UK, would you? Or do you see it all the time?
Well, I mean, I think, look at the problems we've got with getting the law upheld here, because of captured politicians, amongst others. So I wouldn't say it's massively different. I think it varies with governments, how much they are interested in. And so the Labour governments traditionally have interacted more with scientists, and I believe that that's happening a bit more at the moment. So, but then, other governments can be highly ideological, and much better than I do that the civil servants can then only have a bit of some wiggle room, but not full wiggle room. So, yeah, I mean, I think, you go on.
But there you say that some governments are more prone to listening to scientists, but we're talking also here often about captured scientists as well. Like I interviewed a Belgian doctor who's in trouble for conversion therapy because she doesn't affirm kids. She works in psychiatry.
Yeah.
And she said that the field is captured. Like, the field is completely captured. So even their scientific expertise, I don't know to what extent we can still rely on it, and to what extent also the social sciences, from what I hear, is one of the most difficult. But so you were involved in that anyway. And just to get on to the main topic for a sec, which is I'm losing my words, being a TERF, was it during this work that you came across bad gender stats, or did you get into TERFing via some other route?
I think by some other route.
Okay.
A close colleague, social scientist, was moving into trans activism, and I was initially be kind. That's fine. That's interesting. Cis, yes, that seems like a sensible way of terming things. But other women colleagues, he's a man, white man, surprisingly enough. Other colleagues, women who I had conversations with, just started to raise my awareness. So I started, reading as you do, and realized and recognized the problems and the dangers. I think the kind of problem with sexual fetishism and paedophilia, and the fact that sort of trans ideology leaves a door open for people to identify into that for malign reasons, just like the church, just like, But I just had no idea about that side of things. I don't think people in general do. I had no idea that there's, about the changes in the people presenting or thinking that they're trans, and the problem for, young gay women, young non-conforming women. So, yeah, I think I just became more and more aware through. I'm the kind of person who does her research. That's just what I do, very how I deal with problems or puzzles. And so that's how I did it. Physios have an enormous amount of anatomy and physiology in their training. So I know how biology works. I suppose another strand is the awareness of, in the research field and the scientific field, A, the number of men who are at the top versus women, and B, the underfunding and under-attention to women's healthcare, women's anatomy, physiology, and also the healthcare side of things, medicine side of things. So all those things, unsurprisingly led me to the position that I'm in now.
Mm-hmm. Yeah, a few things there. The thing about sexual fetishism and pedophilia, people really don't want to hear about that.
No, they
That's
don't.
what I found.
They don't.
Of all the aspects, they might broach the sport thing. They might, you probably have this experience, as all of us have had, where you start talking about it and people's eyes glaze over and they wander off to do something else because they can't cope with it. But especially the sexual fetish stuff. And it's such a huge part of it. And I don't understand why, because that for me, honestly, was the thing that drew me in the most, because I've met so many perverts, I think. And I just think, I can see easily how this can have very, very negative consequences by opening the door, as you say. And yeah, that's the part I find that people really will not look in the eye.
Well, if you don't mind me coming in, I'll just tell you a very brief story. But so recently in the UK, a child murderer has been killed in prison. He was called Ian Huntley. And those murders took place when I was in my early 40s with 2 young children. And I heard about the murders of those girls and heard more and more about it. But my mind didn't go to paedophile. There will have been a escalation, etc. I was naive and innocent as to this side of things. And I think it's obviously activists want to keep us naive and innocent. But, I can go into town in my city, see an unpleasant looking, aggressive looking man in a dress, and then loads of young girls around. You're just like, ooh. You want women to know, you want parents to know, just to be wise to it. It's one, we're wise to all sorts of things, hazards, but we're not taught to be wise to this.
Well, let me put this to you, because this is one of the most disturbing and shocking things I've heard recently. So I spoke to the woman who was not allowed. I may have spoken about this already on a recent podcast. So for anyone listening to this and you've heard the story already, forgive me for repeating myself, but she wasn't able to foster a child because they found out about her TERF views during the intake, during the assessment period. So she had to go. I don't know if you heard about this woman, Mandy. I think she spoke to the Telegraph or the Times about her story, but absolutely fascinating story where she did this huge, long, arduous assessment by the sounds of it. She had to take time off work. She took redundancy. She had to go through the assessment. And in the end, she was halfway through the assessment when the social worker asked her about her views about equality issues. I can't remember. And in there was the LGBTIQ plus. And she just made the comment that I think that it was after Keira Bell, who had successfully taken the Tavistock to court, which was for transitioning her as a child. And Mandy said to the social worker, I think it's a good thing that that case of Keira Bell now has been settled, so we can see, the evidence pointed in the right direction or whatever. And that was reason enough to stop her application. And it turned out that the chief social worker, whoever called the shots, had transitioned 2 children in her care and was very proud to have.
Live.
Yeah, of course. There's always someone on the team. Only takes one. But I thought that example sort of put to bed the idea that people are naive about the dangers of this, because those women work in the Scottish foster care system. So these are not people who have not witnessed the extremes of male sexual depravity. These people have witnessed the most vulnerable people, the most neglected, like the worst, like Scotland. I'm sorry, but Scotland has just got crazy cases. Like Scotland these women will have seen the worst of the worst, and yet that was their position. So I stopped thinking since I heard that story, I stopped thinking that, because I used to think sort of maybe some people are very privileged and they're not aware. These women are aware. So we need another explanation for that. I don't know.
Good point. Yeah. Well, there are multiple factors, aren't there? The parents who've trans their kids, and if you're in a leadership position and the people under you, want to keep their jobs or be promoted, it's difficult for them to disagree. There's the fear of trans activists and their actions and intimidation of us. So, yeah. And
so that's
financial interests as well, as we know.
That's it. So I'm more now in that direction. It's social identity, it's social status, it's not ignorance. It can't be just ignorance. Some people maybe, but not all the time. Okay, so that's sort of your story. So you are kind of retired, so you're kind of free. So you're going to talk to me about this EU data, and you're not going to be in danger of getting your EU grant cut or anything, because that's not anything that you're looking for. Before we dive into it, can I just say I was doing some rooting around in the EU vague, difficult, confusing policy documents yesterday, and I discovered something really scary, which is a new thing called inclusive gender. So inclusive gender means gender, but for, not in the way you know it. Because there's been this effort for years to make gender mean gender identity as well. So that at the moment in the EU, we have gender policies and we have LGBTIQ policies. And there's this real effort to make it all one under the banner of gender. And then the gender means all the things. It means abortion, and it means trans, and it means all this stuff. And so I've been watching this closely. And yesterday I noticed that scientific projects that get money under Horizon Europe or Marie Curie actions, you probably may be familiar with a lot of these programs, and Erasmus and all this stuff, they all must have gender equality plans. And those gender equality plans, you're excused from it if you're like a very small consultant or independent researcher or whatever, or an NGO, but you're not excused from it if you're a public body. And somebody reached out to me last week and said, is it possible that Bridget Phillipson in the UK is not doing the single-sex space thing following or releasing the new guidance or whatever the situation was, because anything to do with the negotiations that are ongoing right now with the EU over the shape of the new UK-EU deal. So yeah, and so the budget committee from Brussels was in the UK last week, and I think probably not. And I asked some UK TERFs who know some insider stuff. I said, is it possible that the EU's conditions for research funding could have any effect on how the UK is making decisions about this? They said probably not. But it's not beyond the bounds of imagination that if the UK wants to participate in EU stuff, it's going to have to see. This is what Brexit did ultimately.
Well,
Brexit didn't get rid of all the influx of immigrants as a lot of people thought it would. But what it did do was it meant, I guess, that the UK is going to have to follow a lot of EU rules if it wants to, and the EU is very happy about this, obviously. One of those new rules, which will be in place at the beginning of the next framework program for research, is inclusive gender equality plans, which is trans shit. So if you're a public body, if you're a university that receives public funding, you will not be able to get EU funds unless you toe the line on the trans stuff.
Yeah.
So I wonder, and I don't see any indication that the UK is going to have a carve out for any of that because other countries don't.
Well,
Yeah. Did you ever get funds from the EU or anything?
I know people who did.
Yeah.
Yeah, I mean, it's what you've just explained is yet another kind of embedding of this ideology into, across all forms of life. And as you say, it kind of then spin those kinds of policies and sort of, we might even say coerces others, coerces scientists into having to act as if this is a scientifically sound understanding of people, a scientifically sound component of, for instance, recruiting and so on. Yeah.
And it's nowhere, and then all of a sudden it's everywhere, and it's vacancies like this, I think. And when you look at it, if you don't have an expertise in this area like we do, you wouldn't even notice that that's what it means, inclusive equality plan.
Yeah.
But when you see the word intersectionality anywhere, okay, they're talking about men in dresses. Okay. Anyway, so we will talk about the Fundamental Rights Agency survey. So this is a survey that is very important in European policymaking and ultimately in European lawmaking. So I'm just going to explain a little bit what the Fundamental Rights Agency is. The Fundamental Rights Agency is called an independent decentralized agency to provide independent evidence-based advice and expertise on fundamental rights to EU institutions. It helps ensure that EU laws, policies and actions respect the EU Charter of Fundamental Rights. That seems fair enough. I met somebody who worked in the Fundamental Rights Agency, and he told me that it produces figures for activists who come and ask for them. So if activists might say, we need more data on LGBTIQ, then they hook up with the Fundamental Rights Agency. I'm being very cynical here, but this is like the trash version of it. And they say, okay, cool, we must consult Amnesty, we must consult Transgender Equality Network, we must consult blah, blah, blah. And then they produce this data that is fed to the Commission, and the Commission makes the laws based on that data. Every few years, they do an LGBTIQ survey. And the LGBTIQ survey is, I'm not exaggerating when I say it's the basis of it gets cited everywhere.
Oh, really?
Yeah, so this is why it's so important, and this is why I reached out. So it's a large-scale EU-wide online survey conducted by the FRA for experiences of lesbian, gay, trans, intersex, queer people regarding discrimination, violence, and harassment. The first one was in 2012, there was one in 2019, and there was a third in 2023, and we got the results in 2024. This is cited in legal cases, it's cited in parliamentary resolutions, it's cited in the UK as well. All the EU level policy strategy documents, it's heavily cited in the equality strategy, gender equality, national action plans in member states, everywhere. So it would want to be good. It would want to be robust, and it would want to be good. What was your impression when you first looked at this, the 2024 survey results in general?
Well, if I can just say, I didn't just look at the results, I looked at the methods and the technical report, because, that's where I would start as a scientist. What data are you using to make the claims you're using? So, it talks at the kind of headline level of being the largest survey, but of course, big isn't always good. And what was very clear throughout is that the survey, the ethos and the designers and the key people involved in designing and conducting the survey and the key organizations are not neutral. They're not agnostic. They're activist groups. And they also, interestingly, they contracted with research agencies that are primarily consumer research and business-to-business research. So they didn't partner with scientists who are at universities, they partnered with market researchers. And there seemed to be no attempt or assumption that I would always go into a study with, which good scientists do, which is where you might have very clear ideas about something and how something works or the rates of something, but you kind of have to, that's your feeling, and you kind of take that hat off and you put an agnostic hat on where you kind of bracket those assumptions, you need to be aware that you have assumptions about something working or not working, but then you design your research so it asks fairly, is this true? My hunch, what everybody thinks. And there's just no component of that. There's a lot of issues with the recruitment. If you'd like me to talk about that, there are issues about question design, the definition, and then the analysis and the claims made.
Yeah, it just strikes me as really weird that it could be so cited so often and so confidently and yet have such glaring methodological flaws. And I'm just wondering if you have any comment on how can you get away with this? Is this, I'm just wondering how.
I honestly don't know. I mean, you and I talked about what's the name of the better studies on intersex, well, so-called
the DSD Life.
Life. So I think you know more than me about, I've just discovered through this survey and then hunting around for actual more scientific studies that the EU funded a large program of research that was really careful and robust and university-led, expert-led on people with DSDs. And this study is just, I find it bizarre that the EU would spend money on that series of studies. I mean, let me just give you an example. The DSD Live program, the people who they studied had a formal diagnosis of an intersex condition. They had tight boundaries about what counted as a DSD, because we know, it can be fluffy at the edges. So they were quite careful. And the people participating were examined clinically. So it was clear who they were. Whereas this survey just comprised people who identified into being or self-reported as being intersex. And there was a lot of room. They do admit in the technical report there was room for false positives and false negatives in terms of, people who weren't intersex or people who were but didn't know, because the public don't know much about intersex, and even people who have those conditions don't know an awful lot about it. We know that from robust surveys. So, the recruitment, the design of this is absolutely ripe for activism. The recruitment was very much influenced and conducted through activist organizations. And of course, then you get a particular group. It was all digital. So you exclude people who are, who don't have access, for whatever reason. Yeah, there's plenty more problems as well with the recruitment.
Because we zeroed in on the intersex in our conversations before, because I'm really interested in the intersex as kind of a load-bearing theme of trans activism generally, because if you can make people feel fuzzy about whether or not sex is real and binary, then, it's easier for this message to, like, how do you know that's a woman or a man in your room or whatever? So it's quite important. I want to explain the DSD Life study a bit. It's been ages since I looked at it, but this is basically, so the commission, because I've actually worked in one of the big science agencies in the commission. I worked there for a few years. And it's funny what you were saying earlier about your work in kinesiotherapy. What did you call it? What do you call it in the UK again? Physiotherapy. We call it kine over here.
Okay.
And I was working for one of the agencies that worked with the big drug companies. It was a public-private partnership. And we did these things like we would give money to give old people like exercise programs to see if it fixed them. And if it didn't, then we would say to the drug companies, okay, here's a couple of million to develop your drug, and often the physiotherapy worked and we didn't need to fund the drugs. So that kind of thing. And there is very good science being funded by the European Commission. So I just want to make that clear. Very good stuff going on. So we have a situation where we have this DSD Life study, which in theory is actually the only way to sort of deal, let's say, with the DSD topic, which is a rare disease topic. And that is that it's so rare that if you want to have some decent data, you need to take it from you need to have a huge population. In order to get 10 people who have this particular very rare disease, you're going to have to build a database and try and get as many people into that as possible. And that DSD Life study was basically that. And the question that I understand that they're trying to answer in that research was, you've got people who were operated on by default many, many decades ago, and a lot of them turned out really unhappy. And so the activists come to the conclusion that we must stop all interventions. However, we haven't got enough people grown up yet to know whether they're happy with the non-intervention. So what we need is time, and we need people. We need data. And then, so the DSD Life is this long-term thing, and it's going to take a while before correct me if I'm wrong, it's going to take a while before they're able to definitively say, it is better to operate at this age, or it's better to not operate at this age. And we don't have clear data yet. And it seems like a very well-designed study. Would you agree?
Yes, my understanding is it's a wee bit broader than that as well, in that it does look at, what is life like, in various aspects, things like well-being. And they also have published with this big cohort they've got, that they've spent a lot of time and work and money in recruiting. So they know that the individuals involved, which condition, and if you don't mind me saying, you mentioned disease, and I'd probably call it a condition, but which people have which condition, because it's a set of different conditions, which, as you're pointing out, it's challenging to do good research on. And it's not okay to force two people with very divergent DSDs, and that's part of what they're looking at. But I agree that this question of, what in the survey is called something, they call it mutilation surgery with DSDs.
The reason I say rare disease is it helps me place it in my head among other diseases like childhood cancers. Because what I understand from when I was working in this public-private partnership with pharma was that pharma would never invest in childhood cancer drugs because there were so few childhood cancers, because children are so healthy. They'll much rather invest in cancer drugs based on bad lifestyle choices for 40 years. Obesity, diabetes, because there's loads of that. There's very few, and this doesn't just apply to childhood cancer, it applies to loads of things. And so the way I always saw DSDs was they're sort of, from a treatment perspective, or from in terms of developing protocols, the numbers are so small that it's the same sort of issue. Maybe I'm wrong, but it helps me categorize it in my head when I say, okay, well, we can say rare diseases for this bunch of stuff, but because the intersex issue is so linked to identity, it's hard to call it a disease. The disease is a bad word, but I agree. And it's weird in some ways, I think you're saying as well, to sort of, because they're all are very different.
Yeah.
The similarity between all of these conditions is that they affect the genitals and reproductive organs. Is that the thing that they have in common, or is there anything else that they have in common?
Yeah, I'm not an expert at all on it. So, but yes, I agree with your understanding. And I wonder if it might be useful, Róisín, to just mention how the survey defines what they call intersex people.
The FRA survey or the Good Science one? Okay, yeah, go. If you read it out.
It says, there's some unarguable, but the last bit is a challenge. Intersex people are born with sex characteristics, sexual anatomy, reproductive organs, hormonal structure or levels, and or chromosomal patterns that don't fit the typical definition, male or female. You can see what's coming. And I don't have a problem with that. The term intersex is an umbrella term for a spectrum of variations in sex characteristics that occur. But they then say the term intersex acknowledges that physically sex is a spectrum, and that people with variations in sex characteristics other than male or female exist. So we've gone from scientific there to, I would say an anti-scientific position, all crammed in the same paragraph. And yet it's that kind of tells you where they're coming from in this survey. And one of the challenges in the survey is the way they're very, very, their definitions are, they rely on activist definitions, the dreaded Yogyakarta principles. Let me tell you how they define trans, if I can, for a second.
Mm-hmm. In the same survey?
Yeah, in the same survey. Okay, the term trans is used in this survey as a broad umbrella term that includes all those who are transgender, non-binary, gender variant, polygender, agender, gender fluid, cross-dressers, transsexual, or men and women with a transsexual past, and other terms. I wouldn't be happy reading that if I was a detransitioner, but yeah. So it's just, there's kind of it feels a lot of mission creep. And they claim in their sort of claims from analysis that, intersex people, they found absolutely huge numbers of them were gay or lesbian or trans, with different sexualities in enormous numbers. And it just doesn't fit what we know from scientific studies.
So that's interesting. So we've presented this, we've got like all the visual identity of like a genuine, legitimate document. And then the paragraph of the definition of intersex starts off really well. And then it goes from science into ideology, like almost seamlessly. And then we get into other real queer theory terms like agender and polygender and stuff. So we've essentially like melted into nonsense within this document itself. I would say maybe you have a more scientific way of putting it.
Well, it takes a certain position from the outset, which is that these identities are real, they are real entities. They are, unquestionably real, existent, clear, this kind of thing.
Mm-hmm. I'm just looking at how the DSD Life project, which is, so as we were saying earlier, it's running in parallel to this more ideological fundamental rights agency survey, is a real scientific project that the EU also funds. So EU funds all of this. But so we've two projects running in parallel. One is this ideological intersex and the other is scientific DSD. So I'll just read a little bit about the DSD Life project just to demonstrate how weird it is to have the two of these things running side by side and potentially each pretending the other doesn't exist, because how would they claim that they relate to each other at all? Okay, so the DSD Life project, a large EU-funded clinical study running from 2012 to 2018, and from what I understand, the data is still being collected.
How kept going, yeah.
Yeah, coordinated from Charité Hospital in Berlin. It uses the term DSD in line with the international medical consensus established, the Chicago Consensus, which you may or may not know about, but that was the big break from the John Money intersex theory in 2006, which was accepted by lots of activists and rejected by the rest because it was too medical. So this is where we had the split in the intersex world. So this is how they define DSD. It stands for disorders of sexual development, sometimes referred to in the project as differences of sexual development. It is defined as congenital conditions in which the development of chromosomal gonadal or anatomical sex is atypical. The inclusion criteria covers three main categories: 46XX DSDs, so women, 46XY DSDs, so male, and then sex chromosome DSDs, which is those very few that have weird chromosomal makeups, which is a very, very small number of people. So I've just asked Rock, sorry, I'm using AI, but how does it relate to intersex? It treats DSD as the primary clinical medical umbrella term. It acknowledges that intersex is sometimes used by patients or advocacy groups, but the study itself operates within the DSD framework for recruitment. So my big question is, can you, from what you know, tell us where because we have a lot of people in the FRA survey claiming to be intersex, and they've found quite a number of people, which I find shocking, because I know from activism, from following LGBTIQ activists, that they have a real hard time finding anyone who's actually intersex in order to bolster their intersex project. Mm. Where did the FRA get their people from?
Got them by using activist agencies. It was social media campaigns, on the ground activist groupings. They didn't have a way of checking whether somebody really was intersex or not. They're using a survey question which has been sort of written up in research, but it's wide. So the first part of their definition for this FRA survey was, have you ever been diagnosed by a medical doctor or other health profession with an intersex condition or a difference of sex development? That's fine. Or were you born with or developed naturally in puberty genitals, reproductive organs, or chromosomal patterns that do not fit standard definitions of male or female? Now, the challenge with that is do you have genitals and reproductive organs, chromosomal patterns that don't fit standard definitions? It allows people to potentially identifying, one can imagine if one is dysphoric, or one might feel, I don't know, breasts are wrong, penis is wrong. I'm too skinny and skimpy to be a male. And the other thing is, as we know, with sort of social media-led recruitment into doing surveys or signing letters or whatever, we can't guarantee that there aren't people who are very for the cause, who want particular voices to be heard, who will then identify into being so-called intersex for the purposes of the survey. Nobody checked, it was just a self-report. And there are good reasons to think that, various people with particular interests might identify as that. So
can this ever be...
Firstly, there's a group who we know that people's understanding of lay understanding of intersex is very limited. So given the definition they've used, it would be perfectly reasonable for people who, as I say, feel they're too slight or their penis is too small, or, whatever, to identify into that. But also the design of the survey and the lack of any validity checks, truth checking, meant that activists could easily just fill this in, claiming they were intersex and had lots of violence.
So does that mean that any study that we ever come across, even if it's on a topic that, confirm our biases, we can't rely on that kind of data? Is that should those surveys be written off, or is it just like a lower tier quality? What do you think? Is there anything else?
Well, from my scientific perspective, there's real problems with surveys that rely on self-report. Not just surveys. So going back to my physio days, we would sit with older people who were filling in forms for disability benefit, trying to get them not to report how stoical and well they were dealing with all their difficulties, but actually say, it's really bad. So you say what's like on your worst day. Because self-report isn't like this. It's not like you've got something that's true in your head and then it comes out in your answer. We all have different stakes and interests and so on. So with the older people that I was working with at that time, often their interests were in showing that they were resilient and stoic, whereas that didn't fit getting, benefits. So self-reports are always problematic. And just to make a big jump to this survey, what this survey shows is what activists feel report. It's not what the LGBTI, etc. community as a whole feels. And particularly, it's not what people not in touch with activism, people who are, not well involved in the kind of digital world, people who, have reasons to just not engage with anything that might out them, that might collect data on them. So this survey tells us a lot about activists, but it also, it makes claims that aren't based on the data.
And I just, for comparison, in the DSD Life study, which again is the parallel, actual, real cohort of people being studied by real scientists.
Yeah, big cohort, yeah.
Big cohort. Do we have the number? Do you happen to know the number off the top of your head? Because I don't have it here. But they do have a confirmation that participants at a DSD relied on a combination of pre-existing clinical or genetic diagnosis and central verification by the study team. So that covered. So I'll just ask how many people were involved. I know this is bad. This is low tier quality evidence. How many people in that cohort, just for comparison? And that is, I am being told, 1,040. So it's very, very difficult.
That makes it 1,040, which is a lot. Yeah.
1,040, which is a lot, but it just shows you, when I tried to reach out to DSD organizations in Ireland, there were none. Why were there none? Because you'll have in an entire hospital system in 1 year, you might have one case, 2 cases per year or something. Like, I asked my gynecologist how many. She has a party every year with all the babies that she helped deliver the year before that year. And I can't remember, what was it, like 200 babies she delivered in 1 year. And she does that every single year for the past 20 years. And I asked her, how many DSD babies have you had? She said 0. She said one of her colleagues has been involved in a project where they deal with that. So you really have to think how small a number this is. Yeah. So it makes sense to me that this big study carried out over 6 years had about 1,000. However, in the Fundamental Rights Agency, figures, they are claiming that they had a total of 1,087 intersex people.
Yeah. Yeah.
And that was a social media study. So what does that tell you?
Well, it tells you that it's one of the ways that you can go from, this sounds skewed and problematic, to looking at other evidence that helps you see that. So, as you say, we kind of know from the DSD Life that these people are hard to recruit, but there are other things. So I think I've already mentioned, but what the Fundamental Rights Agency survey found is very, very high proportions of people who with self-reported intersex who basically weren't heterosexual. Oh, let's just call it that. And in DSD Life surveys, it's about 80% of people with DSDs are heterosexual. It varies between different conditions, unsurprisingly. But that doesn't fit. And then the main focus of the survey is supposedly on discrimination and violence. I had a DSD Life study with a group of German adolescents. It's relatively small, but it was about their well-being. I didn't look hard, but I suspect if one looked at more better designed studies that come to it from a more agnostic perspective, I suspect that you'd find evidence that the rates of discrimination and violence against, intersex people would be different in more carefully designed studies. There's other weird things with this survey, which I think relate to this issue of just how accurate and careful is it?
The weird claim that I'm interested in, and I can't find the exact figure now, is that an inordinate number of people claiming to be intersex also seem to have been victims of violence or discrimination or hatred. And the reason that sticks out for me is because I've seen it cited on social media, on posters, on flyers, as one of the worst affected groups for hatred.
Yes. That's what they say, but we can assume that that's a consequence of the particular people who filled out the survey. And we know this ourselves. If you've had a bad experience, you're more likely to respond to things. Good experiences too, but bad experiences. But also the fact that it's activist organisations, potentially in a bit of a bubble and, feeling that they are the worst treated of all kind of thing, and then reporting that accordingly as not having a way of checking, is it true, whether that happened or not. So there are those problems. I wanted to mention another couple of problems about their claims. So firstly, they ask one question about whether the person had surgery or other interventions, including interventions on babies, which are done. So, for instance, with hypospadias, where the penis is abnormally formed, it's usual to operate so that those boys don't have all sorts of problems accordingly.
Functional
reasons. Yeah. So they asked one question about whether informed consent was gained. This includes asking the survey people whether fully informed consent was gained by their parents at the time of operating, when they were 2 or 1, which I can't understand. How can that question give you adequate data? But they use that question to then make this claim in analysis. In research studies, what you would do is your analysis and your results are what you can say absolutely that the data showed, but then your discussion is where you kind of extrapolate or play around with what it might mean, how this fits or contradicts other scientific research. That's how you do it. But in this study, kind of straight after the data within the intersex results, as it were, they say, they have a heading, they call it intersex genital mutilation, IGM, is an intervention on a healthy intersex body performed when, according to societal and medical notions, a person's external genitals don't look normal enough to pass as male or female. The term IGM, intersex genital mutilation, encompasses all harmful medical practices, including surgical, hormonal, and other treatments to irreversibly modify sex characteristics of intersex persons for non-vital cosmetic reasons. This doesn't really reflect the views of people with DSDs that have been found in more scientific studies. So in one study of 459, I think this was the DSD Life cohort, part of them. It's a study of 459 individuals. Yes, it was the DSD Life. Sorry, I'm being a bit hesitant. But they were able to divide it up according to different conditions. So 60% of individuals, 66% of individuals with CAH, see, I'm not a DSD expert, but with CAH, and 60% of those with XY DSDA thought that infancy and childhood were the appropriate age for genital surgery. Half of the males preferred early hypospadias surgery, only, and then there's small numbers who feel that they would be better off without surgery. So the survey claim, which doesn't seem to be based on any of their data properly, it doesn't, fit together, also just picks, the carefully sought view of people with DSDs, and it lumps it all together. And we know about false teaming, and, it's not good. There's one other claim, and I'm sure you want to come back to those other claims. So they compare the figures in 2019 to, when is it, 2023, 4? And they say, violence and discrimination has got worse. Well, what's happened during that period in society in general? COVID, austerity, a lot of sectarian kind of disruption, violence, this kind of thing. However we measure it, there does seem to be greater incidence.
Societal strife in general, or?
But they just treat this very, very special population as it just because it's so awful for them. And this is another element of their analysis where you see what you would want to do, I would have thought, at least as part of the study, is to look at the violence and discrimination reported by this populations compared with what we know about violence against women and girls and the rates of that. But by not contextualizing it in that way, again, it's this very special grouping. And it's something that does get on my wick in terms of this kind of hopping over women. So because of being in universities, I've sort of been, and I know this sounds off topic, but, involved in anti-colonialization and, great, having more people of different heritages on reading lists and this kind of thing. This just leapfrogged over women. And this sort of seems the same. It's just, it doesn't contextualize whether those rates are, rates to women have, and how.
Or even the general population, am I right?
What disabled people would be, people with differences would be another way of going, people with disabilities.
Right. So what I would like to understand, okay, so just coming back to the hypostadia stuff again. Again, this is boys who were born and the opening of where the PP comes out is in different places. And sometimes parents want to do it just because it looks weird. And sometimes it has to be done because otherwise they can't pee and they'll get infections, et cetera, et cetera. Yeah. And where that line is I don't think the responsibility or the job of blue-haired, trans-mask NGO people. That's obviously a decision for doctors to make. And there might be times I've discovered in the research into this topic that there are times that it's maybe a bit difficult to say when it's cosmetic and when it's functional. And especially with CAH girls, there's often times when it is cosmetic but psychological because these little girls are born with phallus-like things. And so this is a very, very complicated area. Yeah. It doesn't help, I don't think, for activists to come in and say, ban everything always and call it torture at the UN, get the UN Human Rights Commission to call it torture.
Yeah.
So I had that discussion with Stephanie Wynn a few weeks ago. We recorded an episode about it and I'm going to add it to the show notes. So I want to talk about what the DSD Life study is doing is a really brilliant, I think, is exactly what needs to be done. Is like, right, let's find out the people who had it done at a very early age. Let's find the people who had it done at a later age and find out how their lives have turned out. But then all you're going to end up with is a statistic that, let's say, do you know who Alice Drager is?
Yeah.
Alice Drager, I talked about this with Stephanie Wynn as well. She wrote a book about intersex people with DSDs and about how science got corrupted and how activists took over. It's a very interesting book. It's called Galileo's Middle Finger. And I wrote to her because she was an activist at the time of the John Money system of cut this little phallus off and send this boy home to be raised as a girl, and it's all nurture. She was trying to change that system and she managed to change that system, but she sort of overshot a little bit, I think, because when I wrote to her recently and I was like, hey, I loved your book. It was very good. It also talked about the trans issue. It talked about what happened to Michael Bailey when he he tried to popularize autogynephilia, and the autogynephiles tried to shut him down and destroy his life. So I highly recommend that book. I wrote to her and I was like, "Dear Alice Drager, there's this study going on and they've discovered that, 60% of CAH girls are actually quite pleased that they don't remember the surgery and that they didn't have this phallus and whatever. And then the ones who are unhappy with it seem to be the ones where something went wrong in the surgery and left them with sensitivity issues. And that's also very valid. And do we take the risk?" And then the other argument on the other side is that, well, the tissue is more malleable and easier to work with at that age. Big, very complicated discussion. I'm very glad I don't have to make any pronouncements about it.
Yeah.
And she said, "Oh yeah, I heard that because for her and for a lot of people of that generation, there's the pro-medical side and then there's the peace and love side. And the pro-medical butchers and then the peace and love people that are odds forever." And she said, "Oh, I heard the pro-medical butchers managed to, pay off some people or convince some people to pretend that they were happy with their surgery." So it's a very complicated topic, but there are indeed people who were happy with it. Right. In terms of how this survey was conducted, if you were to, so we know that DSD Life is doing a good job, or as good a job as can be done. I think they are. Then this other thing, we have this intersex, which is a queer identity label. If we wanted to study the outcomes and the life outcomes and the satisfaction and the degrees of violence against people who claim to have this intersex label, regardless of whether it's medical or not, who should they sample? According to the best methods, how would you find those people other than through, activist groups? Like, how are we supposed to go out into the population and take a random sample of the population and then figure out how should it work?
Because the numbers are too small, and also because activism is a potentially skewing feature in terms of people identifying in who wouldn't fit clinical definitions.
Right. Well, hold on. Sorry. Let me ask that question differently. I didn't ask it correctly. Not just talking about intersex, all the LGBTIQ and III+. If I wanted to know how they're doing, how would I find them most in the best way?
That is a massive question because, some definitions are contested. We know that different societies, different numbers of people will report or recognise that they're gay, for instance, for all sorts of reasons. So it is a big problem in that we don't have good knowledge of the LGBTQI, population as a whole. There's two ways of doing it. One is what the DSD Life are doing, which is, well, they recruited through clinics, which works for DSDs that are clinically, diagnosable, but obviously not for being gay, for instance, or bi. For some populations, what you can do if you wanted to do a study is you can sort of purposefully design a sample so that you search for some people who aren't digitally involved. So you have this kind of purposive sampling strategy, it's sometimes called, and it's expensive, where you go out and you try to recruit from particular, hard to reach populations, people who aren't involved in activism. It's really expensive. And this is one of the things that to me is an important thing to understand in the background of good science and this kind of survey, the Fundamental Rights Survey, that even though this Fundamental Rights Survey will no doubt have been expensive in itself, it's much more expensive to really sample for what we would call a representative population. So clearly you can't survey everybody if you're trying to get at a particular grouping of people. And then how you do it is then you kind of design your sample to collect, to try to recruit particular people. They did a little bit of that in this survey. So for instance, they monitored the recruitment, and if they had less people from, Poland, then they made extra efforts in Poland. But so, they do some of that, but just this way of sampling that they recruited will get a skewed sample, and you'd need quite a complex, carefully designed sampling strategy and expensive sampling strategy to try to understand populations more broadly.
So if I wanted to know how many people identify as LGBTIQ, I could take a sample of 1,000 people in every country and say, do you identify as LGBTIQ? And I would quite easily come up with the percentage of people who identify as LGBTIQ. That's one thing. But if I wanted to study the population of that population of people, if I wanted to get a good idea of how people in that community, let's call it the community, how they feel, you're saying I would have to, it would cost me a lot of money and I would have to like figure out where these people might be easy to reach, but also hard to reach, and do geographical, and also do like make sure I get the right age groups. And it will be a big job. Is that it?
Yeah, it would be a big job. You would have LGBTQIA people on the kind of designing group. I'm not against that at all. It's just you'd want a broad set of views, not one set of views. I mean, the other way of doing it would be through the census, but there's problems in how you ask questions on the census. But yeah, this study, just by, using activist groupings that don't cost money to help you recruit and just letting people self-report, it's skewed, and you can't tell how skewed, but you can tell it's very skewed by the things I've been saying. They say this about their sample. You look at, the DSD Life carefully selected cohort of people, and they find very different things. So that's like, that's a bit of a red flag.
I made a mistake in a figure that I mentioned earlier. It's even worse than I said. So I said that in the DSD Life, they have just over 1,000 people who are verified to have one or more of these conditions. And then, whereas in the survey, the FRA survey, they have 1,920 people claim to be intersex.
Yeah.
So that's actually double.
Yeah.
So what I did a while ago, because you were talking about earlier about how, this definition from the activists is kind of vague and open to interpretation. So I opened it up to it broad. I opened up to my interpretation. I've always had one breast smaller than the other, as we all do.
Yep.
So, and my breasts are quite small. I'm sorry to be vulgar, but this is just, so I was like, right, well, do I qualify? So I was like, I'm going to reach out to these people. I'm going to say, I have always felt that my breasts are too small to be normal. My breasts are atypically small.
Yep.
Sorry?
Yep. Precisely. You're making the point precisely. Yeah. Go on.
And so I participated. So I've done a few things. One of them was that the University of Ghent, I can say openly now because I don't care anymore, but the University of Ghent was doing a survey on what looked on the outside like medical, and then you get 2 questions in and you realize it's ideological on intersex. And I was like, yep, I have atypically small breasts, and I'm just waiting to see if the results come out and if I'm in there. I don't know if I'll be able to tell if I'm in there or not, but I was like, can I get through this survey all the way to the end? Took half an hour. Can I get through all the way in the mindset of someone who's conducting the survey on the basis of having very small breasts? And it was like, were you ever discriminated against on the basis of your intersex condition? I was like, yeah, I used to get called, like, what did they call them? Bee stings in school. You know what I mean? So it was like, yes, I have been harassed. I have experienced discrimination. It did happen in school. And it's like, but that's, boo-hoo, and then that was the first thing. And then another thing I did was I reached out to intersex organizations and I said the same thing. And also I remember when I was breastfeeding, when my kids were small, the first time I breastfed, I know now that it's because my son kept pulling off the breast too quickly, so I wasn't making enough milk. But when I was contacting the La Leche League and all that, they were trying to, one of the first things they tried to rule out was whether or not I had this actual medical condition, which was like some sort of tubular breasts or something.
Yeah.
Something like that. And I didn't have that. My son just wouldn't stop pulling away and crying because he wasn't getting enough milk, because I learned with my second baby that actually she would just stay there until she got enough milk. And so there was no issue. But it reminded me when I was doing that survey that, like, yeah, that would be an atypical sort of, your breasts aren't technically supposed to be like that. And it's a thing you only discover when you try to breastfeed, that you've got this tubular thing.
Yeah.
So all kinds of stuff. I even wrote, and this is really vulgar and I'm really sorry, but I even said, this isn't true, but I said my labia looks really weird. And I've always wondered, is there something going on? And does this make me intersex? That one I didn't get any solid answers on, but I did get someone writing back to me saying, has anybody else answered your question yet? Because I'm not sure I know how to answer this. And maybe there are organizations that can help you. So at least that person wasn't willing to say, oh yeah, join the crew. But then I did this other thing. And I wrote to all the intersex organizations and I said, hello. And I pretended, and I have no shame in this because I just don't. I pretended that I was potentially on the lookout for people who could join a research project. Ding, 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 money involved to earn money, something to do with intersex. I can't remember what my pitch was. And I said, but we're just putting together the funding call. We need to just make sure we get down the definition of intersex. We have some questions here in the office on the project team. We're trying to figure out, blah, blah, blah. If you don't mind, I'm going to read out my thing. Seeking expert, intersex terminology for grant program. Hi there, I'm a consultant working for an EU agency that will soon launch a fund for social projects on the general theme of social inclusion, multiple marginalization, diversity, etc. I have been tasked with drafting some of the calls for projects, and one of the target groups is the LGBTIQ community. In order to create materials that will reach the correct potential grant recipients, I would like to get in touch with an expert who could answer some questions about definitions relating to the intersex community. I said, I'm familiar with OII Europe. I'm familiar with all those terms, but there were some questions running around. I don't want to get the language wrong to further risk stigmatizing a group that already suffers from marginalization. By the way, like, nobody can tell that your urethra is in the wrong place, by when you're walking down the street. So this idea that they're targets of hate all the time is obviously nonsense.
Well, this is why group, some of whom, it's a very visible, but for some of whom you wouldn't know. And we know that causes differences in experiences.
Yes. I mean, being a gay guy and walking down the street with your boyfriend and having people throw stones at you, that is very clear act of discrimination or violence on the basis of being a member of the community. But having had hypospasia surgery so that you can pee properly 40 years ago, I just don't think that qualifies. And just to come back to, something that you mentioned earlier, the high number of people who claim to be intersex who are non-heterosexual, the number of people who claim to be lesbian, gay, bisexual, asexual, pansexual, other sexual orientation was 95%.
They were recruiting. They were recruiting for that. Yeah, but as we know, this kind of forced teaming is a bit problematic. And
it doesn't make any sense.
Definitions is a bit sort of problematic.
And by gender identity, because I thought this was important, 40% were non-binary. 40% of the intersex people claim to be non-binary.
Yes, exactly. And that doesn't fit with what the DSD Life sort of program is finding about the numbers of people with confirmed DSDs who identify as other than heterosexual.
Yeah.
I think you were talking about your experiences of discrimination in relation to having small breasts or asymmetrical breasts. And if you're particularly tuned into something, then how you kind of categorize an experience that happens to you is affected by the lens that you're looking through. And this is, so if you're very involved with activists and you are believing microaggressions, then if somebody looks at you, you could interpret that as, oh, they've spotted I'm abnormal, I'm being discriminated against here. It's really difficult, as you say, getting stones chucked at you when you're holding hands with your boyfriend, if you're a gay man that's clear. But I think there are some of the more subtle, less overt and obvious things that it's very difficult to know whether those are experiences of discrimination or not. This is partly why I raised the fact that they're saying things got worse for this population 2019 to 23, where that it has been a general rise in people just being vile to each other. How do the women with DSDs differentiate between discrimination, abuse for being female, which I think pretty much all of us have experienced, versus that's because you've got a DSD? We can't know. They've no interest in that in this survey.
Yeah.
It's clearly, you can kind of see the whole loads of elements of the design are skewing it towards very high reported rates of discrimination and violence.
Yeah. If 40% of the 2,000 people who claimed to be intersex, they're also claimed to be non-binary, and a lot of them are claiming to have been victims of violence and discrimination. How do they know that discrimination was directed towards them on the basis of being female, as you say? How do they know that it's not on the basis of being non-binary, which they're not because nobody is, but dressing and appearing in a certain way that makes them stand out as a queer identifying?
Yeah, what we would have called gender non-conforming. Yeah, absolutely. How can you tell? But it's because you have this clinical condition, if you have it, versus, as you say, you're gender non-conforming or you're a woman who dresses in a particular way. How can you know?
Sometimes during this conversation, I'm just realizing how bizarre the whole thing is. And I'm like, I can't even believe we have to talk about it because it is so silly. The whole thing is so silly. To round us off, I'll just give you an answer to one of the answers I got to my emails. And most of the people who responded to me said that, could you tell us more about your organization? Because they got a weird feeling. They were like, somebody's basically offering me money and asking, please just put down in print what it is exactly that intersex is, because I think I put my weird proposals to them, like, for example, I said, I understand that intersex is not quite the same as DSDs, but from what I've read, it does appear that one must have some kind of DSD in order to be considered intersex, even if they choose not to adopt the label. Is my understanding correct? For example, if the call text that I'm writing seeks individuals with natural innate variations of sex characteristics, what kind of language can we use to make sure the criteria are not mistaken to mean all kinds of innate variations, such as excuse the specifics, unusually large or small, secondary sex characteristics such as breasts, micropenis, or unusually high or low levels of certain hormones, such as in the case of PCOS, or perhaps unusual bodily variations such as misshapen genitalia, body fat distribution in the pattern of the opposite sex, or other variations that could be considered natural or innate. The concern is that variations of sex characteristics could potentially be too broad and attract the wrong group of grant applicants. So I went on and on a little bit there, but I think that's sort of where I was trying to narrow down, like, where does the medical stop and the ideology start? They mostly told me, who are you? I don't believe you. But one person said, hi, the best partner to discuss is with, and this was a Dutch one, is Go Here. They have the largest possible definition of intersex of all the countries concerned in this matter. We hate the medical definition of DSD. So he or she gives me these words: experience, perception, feeling, and sensation are 4 words that can be used in our case. They almost have the same meaning, but the little differences make up the gap of comprehension. Some of us are invisible and you can't see the difference from the outside. Others, you can distinguish them from miles away. The 2 different sides of living as intersex. That's why a good definition of intersex has to be very broad. And that's why experience, perception, feeling, and sensation have to be part of our history. So I think my interpretation of that is saying, it's a vibe, man. So you may or may not have that. And I have come across interviews with people who were like, I identify as intersex, and they have a genuine DSD because they want to be part of this community. But when I wrote to DSD Families, which is the biggest organization in the UK, which represents also Irish people, they didn't answer me, but they do not use the term intersex. But what's interesting is that they don't want to get involved, you know?
Yeah.
They don't want to denigrate the people who call themselves intersex because it's called DSD Families. And I think a lot of them are parents who are very happy that their kids have found other people who identify in the same way. I can imagine.
Yep.
You know?
Yeah. This reflects the kind of aspects of the activism around just smushing boundaries and making categories so broad that they become meaningless, or making words have multiple meanings. Kathleen Stock covers this beautifully in Material Girls in terms of, 4 different ways the term gender is used that are massively different. And so, intersex activism, by the sounds of it, amongst some groupings is becoming a very, very, very broad category. And of course, this is of no help both to people who actually have DSDs. It's of no help to women's sport if you say, well, anyone's intersex. So, and you kind of smush out the actual clinical sort of scientific insights, which are by no means perfect themselves, but there are good reasons to have clear categories and clear boundaries around, what we can say we are. So you and I would say there's very, very good reasons to have clear boundaries around what a woman and a girl is, what a female is. And if we don't have those boundaries, it causes, numerous problems, which is the content of many other podcasts. But, this boundary creep is really, it's just unhelpful to human society, to making lives better, all of those.
I think the point of intersex activism is just the boundary busting, because it exists. Okay, so there's quite a number of people who are going to make a living out of it. There's some real charlatans that I've come across. There's a big OII, which is the big stonewall of intersex activism.
Yeah.
But I think the idea of it is, don't ask us too many technical questions. We're here to tell you that sex is a spectrum. That's the bottom line. And I just want to really upset you before I let you go, because I just looked it up and I found that DSD Life got 1.6 million in EU funding. And OII Europe, I happen to know they got at least 500,000 per year they get in EU funding. So this is just absolutely absurd that the same people who are funding the actual study of this cohort get 1.5 million, and the OII Europe got operational funding last year, and I cannot remember how much it was, but I think it was at least 500,000. So that's money. I'll confirm that in the text that goes out with this podcast, but that was money that could have actually been spent on this real research, getting more universities, hospitals to add their add data to the cohort.
Yeah.
And so I think that that's an absolute dereliction of duty to taxpaying citizens, and I think it's utterly just bananas. And we're at the dark side of the moon right now. It's sort of what it feels like in terms of ideological capture of research. What do you think? I'll give you the last word and then I'll let you go on your day.
No pressure. Well, yes, we are. And I guess that's why, we need to share our knowledge and skills and understanding with one another so as to be able to counter this kind of thing. But yeah, there's some enormous influences that are very, very difficult to change, very powerful men.
What are the chances of getting this out of the UK health? Because it's fully embedded in the NHS. Is it bad in UK research?
If you're applying for research from the core healthcare funder in the UK, you do have to gather data on both sex and gender, but at least it's got sex in it.
Mm-hmm.
I mean, my biggest study was with people who were dying in hospices, and mostly elderly ladies and elderly gents. And there are people who were on my team who now believe we should have asked those elderly dying people what their gender was and, what sex they were assigned at birth. It's just, yeah.
Did they ever explain why?
Because they think that it's gender identity that kind of is a very, very important thing about a person.
Because I've asked people who were promoting this in the commission a few years ago, I asked them why, because this became a big project a couple of years ago, disaggregated data, sex and gender. And so there's a very serious task force of very serious people with scientific backgrounds trying to answer this question. And the best that they could come up with, but at least it was an answer, I'm going to paraphrase them now, was the gender that you are, as in the expectations and the role and the stereotypes, can have an effect on your health, in the sense that girls don't play as much sport as boys because of gender stereotypes. So you can say, right, okay, that's, it's so stupid, but at least it was an attempt to answer it. I felt I was like, okay, but apart from that, there's nothing. It's like, if you know the gender of someone, as in I'm pretending to be a girl even though I'm not, it's like, okay, well, you're not expected to play football then. It's so dumb, but this is embedded now. But at least we have the sex and the gender, as you say. But what we end up with then is two parallel tracks, like with the DSD Life proper study and the Ideological FRA survey results, where you've got the real thing and then you've got the fake ideological thing. But the fake ideological thing adds to the threat that the fake ideological thing will be taken seriously. And,
Yeah. No,
I'm glad we need to get it out.
Yeah.
All right. Well, that was all very stupid, but we draw attention to it in the hope that we embarrass people out of quoting this thing ever again. So thank you so much, because I just gonna like try and blast this at all the people who were citing this stupid data, and I'm gonna say, look, this is on your record now that you're citing this nonsense. So Ruth Parry, thank you so much for joining me. Where can people find you if you'd like to be found? If you don't want to be found, don't tell us anything about your Twitter accounts or anything.
No, I'm going to leave it that people have to work a bit hard to find me.
Okay. Well, they can't do anything to you now. You're basically retired. You're a free woman and you're a very good TERF. Thank you very much for TERFing with me on this fine morning, and I shall be in touch.
All right. Thanks.
Ciao.
Bye.
If you like my work, you can subscribe to my newsletter by going to peaked.substack.com and taking out a paid subscription.